Ireland has the highest rate of hereditary hemochromatosis in the world. In fact, it's often referred to as the Celtic disease, with 1 in 5 people being considered carriers. But now there is good news for some patients. And I'm joined today by Dr. Stephen Field, who's the Medical and Scientific Director for the Irish Blood Transfusion Service. Dr. Field, great to see you.
Well, thank you. It's nice to be here.
Tell us first, for those who might not know, what is hereditary hemochromatosis, or HH as it's known?
Hereditary hemochromatosis is, as the name implies, an inherited condition in which there is an accumulation of iron through various biochemical mechanisms in the body. And of course that iron goes on to damage major organs in time as it accumulates.
So they go to their GP and they say, I've got these problems, and the doctor does a test and determines that they have HH.
Yes.
And then what's the first thing that they start to have to go through?
Yeah, what happens is the doctor finds that they have a high ferritin level. Now, ferritin is the protein in the blood which carries the iron. Okay. And it's the indicator substance to show that there's a problem. And to just give you the quantum, the normal ferritin is somewhere between 15 and 45.
Okay.
And these patients, when they're first diagnosed, can have ferritins of 3,000.
Oh my gosh.
Yeah.
So in general, if you're an HH patient and you'd like to donate your blood, how do you know if you're eligible?
If your medical practitioner has determined you require up to 8 phlebotomies per year, then you would be eligible, which we could do 4, and your medical practitioner could do the other 4. If it's more than 8, then you need to remain with your medical practitioner until that level has reached a level of 8 or less.
So if you're 8 or under at this point, go to the website, find out if you can come and donate your blood for free and to benefit others.
That's correct.
And what are the benefits of someone giving his or her blood at the Irish Blood Transfusion Service?
Okay, well, first of all, they need the phlebotomy, so the benefit for them having the blood taken off.
They're going to have it done anyway.
So they can come to us 4 times a year and get their blood taken on a regular basis. But instead of the blood being thrown away as it would be in the hospital or general practice situation, the blood will be used on our patients in Irish hospitals who would benefit.
So you have to give your blood anyway. You come to the Irish Blood Transfusion Service and it's free, and your blood that's donated then is provided to others in need.
That's correct.
Let's talk a little bit about the general need for blood in Ireland.
Well, only 3% of the Irish population, eligible Irish population, are blood donors. We've got constant need for example, O-negative blood. We're always short. We're short of sometimes short of the other blood groups too. It fluctuates from
But
time
O-negative
to time
is, I think, the universal donor.
O-negative is the universal donor. I think there is a natural reticence to donate blood. Not everybody can do it. Some people have what we call syncopes.
What's syncopes?
That's where you faint.
Okay.
Perhaps at the sight of blood or the needle or something like that.
I've never fainted, but when I've tried to give blood, my vein has collapsed.
And that's another reason some people can't. But the great majority of people actually can.
And just haven't tried, maybe.
Some haven't tried,
And when
yes.
we talk about these hereditary hemochromatosis patients who have to give their blood or have the phlebotomy, as you explained it, then now coming to the Irish Blood Transfusion Service is a free and effective way to do what that's going to be required anyway, but to give that blood then to others in need.
Yes, absolutely correct. And I think that is important to say, to give the blood to people in need. It must be that altruism in donating goes with it. The fact they're getting a free service for their phlebotomy is one thing, but there must also be the desire to help one's fellow person in terms of donating the blood.
What significance does it mean if the HH community comes forward and begins to donate their blood and not have it be wasted?
It will increase our blood stocks by approximately 12,000 units per year, which is 10% of our total blood supply. I think it frees up beds in the daycare centres. I think it frees up time for the GPs. But I would just like to reiterate one thing, and that is the care of these patients with hemochromatosis still remains with their medical practitioners. We're not going to be monitoring their ferritin levels and things like that and their general health, other than the normal questions we would ask to see if they're eligible. But they still need to see their doctors on a regular basis to ensure that the ferritin levels are adequately controlled and their health is being looked after.
What if you are an HH patient, but you find out that you're not eligible to donate?
Unfortunately, we will not be able to take those particular individuals, but what they can do is encourage other family members who may also have the disease and are eligible to avail themselves of our services and donate blood with the Irish Blood Transfusion Service.